Hi, everybody. My name is Marian Icladius. I'm going to be presenting today a basic CT overview. What is CT? A CT scan is a non-invasive medical imaging method that uses X-rays to create detailed pictures of the inside of the body. It helps doctors diagnose, plan treatment, and monitor health conditions. CT scanning began in the early 1970s, thanks to Godfrey Hounsfield and Alan Cormack, who developed the mask needed to turn X-ray data into 3D images. They received the Nobel Prize in Medicine in the 1979 for their work. The first CT scanner was installed in 1971 at Atkinson Morley Hospital in London and was used to scan the brain. CT technology has since improved greatly, and today's scanners can image the whole body quickly and in high detail. How it works: CT scanners uses an X-ray tube and a detector. The patient lies on a table that moves through the scanner. As X-rays passes through the body from different angles, detectors measure how much is absorbed and how much passes through. This is called attenuation. A computer uses this information to create cross-sectional images or slices of the body. These slices can be combined to make 3D images. Dense tissues like bones absorb more X-rays, so fewer reach the detectors. Less dense tissues like lungs absorb fewer X-rays, allowing more to be detected. Each type of tissue is given a value called a Hounsfield unit based on how much radiation it absorbs. Unlike traditional X-rays, which produce flat 2D images, CT scans use advanced computer algorithms to combine multiple angled images into detailed 3D views. These images are displayed as slices on a monitor, helping doctors examine the body in much more detail. Modern CT scans are fast, detailed, and use low doses of radiation. Advanced types like dual energy CT and spectral imaging provide even clearer views of certain body structures. Why is CT used? CT scanning is commonly used in medicine to help diagnose and treat many health problems. It provides clear, detailed images of the body and can be used to detect and monitor cancer in different organs, check for injuries to the brain, spine, chest, abdomen, and pelvis, diagnose and track heart and blood vessels problems like blocked arteries or blood clots, find and monitor infections in various parts of the body, examine bones, joints, and soft tissues for damage or disease. Types of contrast and uses. Contrast is a special dye, which is iodine, that helps certain organs or tissue show up more clearly on the scan. It can be swallowed or injected into a vein through an IV. Intravenous contrast. It is when a contrast is injected into a vein, it travels through the bloodstream and helps doctors see certain areas more clearly. Some of the main uses include cardiovascular system. IV contrast is used to see blood vessels and check for problems like aneurysms, tears in the blood vessels, or clogged arteries. Tumors. It helps doctors tell if a tumor is cancerous or not because tumors show up differently with contrast. Urinary system. After being injected, the contrast travels through the kidneys and into the bladder, which can be seen on the scan. This is called a CT urogram, which is replacing an older test called the intravenous pyelogram. Oral contrast. Sometimes patients drink contrast before the scan to help doctor see the digestive system, including the stomach and the intestines. This is useful for diagnosing conditions like Crohn's disease. It's a condition that causes inflammation in the digestive tract, bowel obstruction, a blockage in the intestine, diverticulitis, inflammation of small pouches in the colon, appendicitis, inflammation of the appendix. Oral contrast helps highlight these areas so doctors can easily spot problems. Benefits: detailed images. CT scan provide high-resolution images that help doctors see inside the body more clearly than regular X-rays. Accurate diagnosis. This allows for better and earlier diagnosis of many conditions. Treatment planning. CT is useful for monitoring how well treatments are working. Non-invasive. CT offers a way to look inside the body without surgery. Drawbacks: radiation exposure. CT uses ionizing radiation, which can increase cancer risk with frequent use. Cost and access. CT scan can be expensive and might not always be covered by insurance. Access may also be limited in low-income or rural areas. Common CT exams. CT scans are commonly used in healthcare to diagnose and treat many different medical conditions. Some of the conditions that CT scan can help identify or monitor include cancer. CT scans can help detect and track tumors in different parts of the body. Injuries, they can be used to check for damage to the brain, spine, chest, abdomen, or pelvis after accidents or injuries. Heart and blood vessel issues. CT scan can help diagnose and monitor conditions like coronary artery disease or blood clots in the lungs. Infections. CT can help identify and monitor infections throughout the body. Bone and joint problems. CT scans are used to diagnose issues with bones, joints, and soft tissues. Risks and considerations. Imaging tests that use radiation are done safely and only when necessary. CT tests should be justified, meaning it's the right test for your condition and the benefits are greater than any risk. Then optimization should be utilized, meaning getting the best images while using the lowest possible amount of radiation. If you are pregnant or even think you might be, it's very important to tell your doctor before you have a CT scan. While the amount of radiation used in a CT scan is generally low, it can still pose a risk to an unborn baby, so your doctor may choose a different type of test that is safer during pregnancy. Children are more sensitive to radiation because their cells divide more clearly as they grow. Their smaller size and weight also affect how much radiation they need and how to avoid exposing nearby organs. That is why when imaging children, doctors are extra careful. They make sure the scan is truly necessary and use special child-size protocols to keep radiation exposure as low as possible. CT scans themselves usually don't cause side effects, but some people develop minor side effects from contrast material. These side effects may include nausea and vomiting, headaches, or dizziness. In conclusion, computed tomography is a powerful and flexible imaging tool that play a key role in modern healthcare. It allows for quick and accurate diagnosis of many medical conditions, from trauma to cancer. While there are some risks related to radiation exposure, especially with repeated scans, these are carefully managed through proper guidelines and dose reduction strategies. As technology advances, CT scanning continues to become safer, faster, and even more effective in supporting high-quality patient care. Thank you so much for listening.